Welcome to Roadmap to Residency, and in this video, we will be discussing about autonomic and neuromuscular drugs. So, 55-year-old man is admitted to the intensive care unit for acute respiratory failure secondary to severe pneumonia. He requires mechanical ventilation for respiratory support, and due to his worsening hypoxemia and hypercapnia, the ICU team decides to initiate neuromuscular blockade to facilitate the mechanical ventilation and to improve the patient ventilator synchrony. Which of the following neuromuscular blocking agent is the most appropriate initial choice for this patient? Vecuronium, succinylcholine, etracurium, rocuronium, or pancuronium? So the answer is rocuronium. So the neuromuscular blocking agent are medications that act at the neuromuscular junction to produce skeletal muscle paralysis, thereby facilitating endotracheal intubation and mechanical ventilation in critically ill patient. Rocuronium is a non-depolarizing neuromuscular blocking agent that is commonly used for rapid sequence intubation and neuromuscular blockade in the ICU setting. It has an intermediate duration of action and onset of action, making it suitable for short-term paralysis during intubation and mechanical ventilation. Rocuronium does not cause the histamine release associated with some other neuromuscular blocking agents, making it preferred choice in patients with cardiovascular instability or non-sensitivity to histamine. So we have one more question here. So which of the following muscle relaxant is the most appropriate pharmacological therapy for this patient's acute low back pain and muscle spasms? A 35-year-old woman presents to the emergency department with complaints of severe low back pain and muscle spasms after lifting a heavy object at work. She reports difficulty walking and performing daily activities due to the pain and stiffness in her lower back. On examination, the patient is in moderate distress and has tenderness to palpation over the lumbar paraspinal muscles. Straight leg raise test is positive on the right side, reproducing radicular pain down the posterior aspect of the right leg. Motor strength and sensation are intact in the lower extremities. The patient's pain is not adequately controlled with non-steroidal anti-inflammatory drugs. Which of the following drug is most appropriate pharmacological therapy for this patient? Baclofen, cyclobenzapidine, tizanidine, methocarbamol, or orphenadrine? So the answer is cyclobenzapine. So acute low back pain with muscle spasm is a common clinical presentation in the emergency department. Muscle relaxation are often used as adjunctive therapy to relieve muscle spasms and improve pain control in patients with acute musculoskeletal pain. Cyclobenzapine is a centrally acting muscle relaxant that is commonly used for the treatment of acute musculoskeletal conditions, including acute low back pain with muscle spasm. It exerts its pharmacological effects by acting as a non-selective antagonist at the serotonin receptors in the brainstem and spinal cord, leading to inhibition of alpha and gamma motor neurons and reducing skeletal muscle tone and spasms. It also has sedative properties, which may help improve sleep disturbances associated with acute pain. Here we can see the cholinergic neuroeffector junction. So there is intake of the choline and which combines with acetyl-CoA. Now by the enzyme choline acetyl transferase, it forms acetylcholine. So acetyl plus choline, it forms acetylcholine, and these acetylcholine are then stored. And whenever there is calcium influx, it initiates a release by the uh, release of acetylcholine from the vesicles. So when there is release of acetylcholine, it can either go and act on the receptors, the muscarinic and nicotinic receptors, or it can get metabolized, or it can get broken down by acetylcholine esterase and into choline plus acetate. Now, the drug that is acting on uptake is the hemicolium, which decreases the uptake of choline. The drug that acts on release, that it inhibits the release, is the botulinum toxin. Acetylcholine esterase inhibitors act on acetylcholine esterase, and they are receptor agonist and antagonist, which act on the specific muscarinic and nicotinic receptors. And then they all produce the effector. They all produce the effects. Now, talking about muscarinic receptor activation, there are different sort of muscarinic receptor ranging from M1 to M3. Now, in the eye, in the ciliary muscle and sphincter, there is M3 receptor. So there is, if there is activation of M3 receptor, then it causes contraction or meiosis, and it causes contraction for the accommodation for near vision. In acid node and AV node, there is M2 receptor. So if it gets activated, it decreases the heart rate, it decreases the conduction velocity. In lungs, there is M3 receptor. If it gets activated, there is contraction leading to bronchospasm and increased secretion. In GI tract, there are M3 and M1 receptor. If M3 receptor gets activated, it causes increase in the motility or cramps and contraction leading to diarrhea. If M1 receptor is activated, it causes increase in the secretion. In bladder, There is M3 receptor, which causes contraction, relaxation, voiding, and urinary incontinence. In the sphincters, there is M3 receptor causing relaxation, except the lower esophageal sphincter, which contracts on M3 activation. The glands consist of M3 receptors mostly, and it increases the secretion of the glands. In blood vessels or endothelium, there is M3 receptors where there is dilation, and there is no innervation or no effects of indirect agonist. Acetylcholine esterase inhibitors. So these are different types of acetylcholine esterase inhibitors. Idurofonium is a short-acting drug and is used for myasthenia gravis. Physostigmine is a tertiary amine, so it can enter the CNS, and it's used for the treatment of glaucoma. And it is also an antidote atropine overdose. Neohistamine pyridostigmine is a quaternary amine, so there is no CNS entry. The treatment is for ileus and urinary retention. Donepezil and rivastigmine is a lipid-soluble drug, which means that it can enter the CNS and is used for Alzheimer's disease. Organophosphate drugs are lipid-soluble and are irreversible inhibitors. So it is used as an insecticide and it can cause OP poisoning. Muscarinic antagonist. So these are the clinical uses and characteristics of muscarinic blockers. So atropine is a sort of muscarinic antagonist, very important drug. It is used for as an antispasmodic, antisecretory, and management of acetylcholine esterase inhibitor overdose. Tropicamide is used for ophthalmology as a topical agent. Ipratropium bromide, tiotropium bromide is used in asthma and COPD. Scopolamine is used in motion sickness. Benztropine is used in Parkinsonism. And oxybutynin is used in overactive bladder in case of urge incontinence. Now, nicotinic receptor antagonists, what are the effects? So, if it acts on the arterioles, it will cause vasodilation and hypotension. If it acts on the veins, it will cause dilation and decrease in the venous return. If it acts on the heart, it can cause tachycardia, iris, mydriasis, ciliary muscle, cycloplasia, GI tract decreased tone and motility, bladder urinary retention, salivary glands xerostomia, and sweat glands causing anhidrosis. Thank you for watching. Keep studying.